Welcome to Thursday's edition of COVID-19. I'm Min San-hee. Here in Korea, employees at a fast food restaurant are among the latest to join the list of cluster infections in the metropolitan area. We take a closer look at these continuing cases of domestic transmissions in our studio session later on, during which our experts will also touch upon Russia's claim of a vaccine. We start the program now with the latest numbers on the pandemic with our Kwon So-ah and related news this time with our Kim Ji-yeon. So I hear local infections saw a surge today.
Yes, cluster infections, especially in the metropolitan area, which are traced to churches, markets, schools. And as you just mentioned, one of the newest cases are linked to managers' meeting of a fast food franchise here in the capital. So let's take a closer look at Thursday's figures. We have 47 local cases and 9 imported cases. So 56 is the caseload we're seeing today. The death toll remains at 305, and unfortunately, we have 25 more people in quarantine compared to yesterday, but also more than 30 new recoveries, raising the total to 13,817. Now, the average of daily cases since last Thursday stands at 39, but as you can see here, we are having 2 days consecutively in the 50s. Now, let's take a look at our map. Now, as you can see, most of the new cases are concentrated in the metropolitan region. 26 in Seoul, 17 in nearby Gyeonggi-do province, and 25 in Seoul and 16 in Gyeonggi-do province are all local transmissions. And we also have 3 cases that were detected at the nation's airport or seaports, while 6 other imported cases occurred sporadically across the nation during the 2-week self-isolation period. Now, while imported cases here in Korea are down to the single digits, global figures are not slowing down. Let's take a closer look. More than 20.8 million cases in total, as some 285,000 have been added in the past 24 hours. We have over 747,000 fatalities and 13.7 million recoveries. And let's go over to the major outbreaks across the world. The U.S. at 5.36 million, Brazil 3.17 million, and both of these are seeing more than 50,000 cases on a daily basis, while India is seeing even over 67,000 cases were reported in the past day. Meanwhile, Russia is seeing some slowdowns, but has hit the 900,000 mark, and a concern in Peru, which has the highest death rate per million in the Americas, above the U.S., Brazil, Chile, and Mexico. Speaking of Mexico, Peru has just surpassed Mexico's total cases of 498,380. And now we are having, not on this table right now, but right below the UK, we have Saudi Arabia with the 13th highest number of infections, which now has over 293,000 total cases. And that's a place where Sunny will connect later to a resident there. And I'll be back later after the government briefing. Sunny.
All right, so thank you for that. I'll see you back at the desk following the regular briefing. Now, we've been covering the impact of COVID-19 on the defense sector, and today we look at the effect on Korea's weapons development. The country unveiled recently a prototype of an advanced radar system for its fighter jet, which is being jointly developed with Indonesia. There appear to be a few hurdles, though, amid the pandemic. For more on this, I have our Defense Ministry correspondent, Kim Ji-yeon, here in the studio. Welcome, Ji-yeon.
Good to be back.
Right, Ji-yeon, do tell us more about this radar system.
Sure. Active Electronically Scanned Array, or ASAR radars, are the eyes of the aircraft that can detect and track multiple targets simultaneously. Basically, it's a detection system and is crucial in the identification of enemy forces during aerial warfare, and also enables fighter jets to track enemy forces during ground surveillance. The beam of the radio waves is electronically steered to a point in different directions without the need to move the antenna. The system has been under development since 2016. I recently visited the state-run Agency for Defense Development to talk to the developers of the new system. Take a listen.
Our 7th ASAR radar unit is currently under production. We've been asked to meet the requirements of the military equivalent to that of F-16 fighter jets. to be able to simultaneously detect up to 10 objects from 50 to 60 nautical miles away.
So according to the Defense Acquisition Program Administration, the prototype will be installed on the envisioned Korean Fighter Experimental Multi-Role Fighter Aircraft, or KFX project in short, after going through system integration and flight tests lasting until 2026. South Korea launched the near $7.5 billion KFX project to roll out its first mass-produced homegrown fighter jets by 2026.
Right, Jeon. And how has COVID-19 affected the KFX program?
So some 100 Indonesian technicians were to participate in the joint KFX project. They've stayed in South Korea since the project kicked off years back, but in March, they returned to Indonesia due to the coronavirus. It's still uncertain if they're going to be able to participate in South Korea due to travel restrictions following the pandemic. Indonesia has been implementing a partial lockdown as well as a large-scale social restrictions in several areas to contain the virus. And the country has been suffering from the worst coronavirus outbreak in Southeast Asia, with the number of new cases rising by 1 to 2,000 on a daily basis.
Jeon, has COVID-19 affected the program's development timeline, though?
Fortunately, it has not. And this is due to the early implementation of South Korea's massive testing and quarantine measures. The KFX program appears not to have been affected by COVID-19. The KFX prototype is expected to conduct its first flight in 2022 as scheduled, to be equipped with the ASAR radar system the following year. And the move to re-engage the technicians on the project comes amid continued delays in efforts to reach a compromise on the scope of Indonesian financial participation in the program, amid concerns Jakarta is re-evaluating the strategic value of its involvement. So all in all, there has been unresolved issues regarding Jakarta's participation in the project before the outbreak, but it has been exacerbated, and the coronavirus has been impeding the two countries' efforts to clear it up.
Jeon, I hear that even before the outbreak, like you mentioned, there have been reports of Jakarta not keeping its end of the financial obligations for the project. Please tell us more.
Yeah. The South Korean media has widely reported that the Indonesian government has failed to pay more than $420 million out of the $1.5 billion, some 20% of the project's total development funds. And Jakarta's last payment was confirmed to be made in 2018. And the coronavirus has impeded efforts to renegotiate the amount of payment between the two countries after the Indonesian government has asked for a renegotiation of a deal. In a ceremony marking the unveiling of the ASAR radar system last week, a DAPA official confirmed that up until last year, there was some agreement on the payment amount, but due to COVID-19, the two sides are not able to meet to resolve the issue, adding that it's very unfortunate because the project was initiated with a spirit of joint development. But for now, Jakarta is currently focused on containing COVID-19 in the country. And through the deal, Jakarta was to get some of the shared tech related to the KFX project.
I see. All right, Jeon, thank you for that report. Hopes to see you again back soon.
Sure.
Right, it's a little after 2 in the afternoon here in Korea, and we are poised to join the regular afternoon briefing on COVID-19. Cluster infections have hit a number of places in recent days here in the metropolitan area, ranging from churches to a traditional open market to an educational center, and more recently a fast food restaurant. In light of these events, authorities are calling on members of the public to abide by stringent safety measures, including the wearing of face masks and the avoiding of congested places. Also, given the growing number of infections that cannot be traced, officials are advising people to refrain from gatherings that can be avoided, including those simply for socializing purposes. The briefing is about to start, so we'll come back to you afterwards.
First of all, here is Deputy Director Kwon Junuk with the briefing. Let us now begin our regular briefing for August 13th, Thursday, on the COVID-19 situation here in South Korea. As of today midnight, we have 47 new local infections and a total of 9 new imported cases. The total number of confirmed cases now stands at 14,770. 31 people have been discharged as of yesterday, and a total of 648 people are still in quarantine. We have 15 people with severe or critical conditions with no additional fatality. And here are some updates on our domestic infections by region. First, in the city of Seoul, in Gwanak-gu district at the Euncheon Nursing Hospital, we have additional 2 cases being confirmed, and the total now stands at 8. And related to the Seoul Regional Lotteria staff meeting, we have confirmed that 19 members who were at the meeting and a total of 53 people have been tested. And we have confirmed that 3 people out of the meetings and as well as 1 employee has been confirmed, and a total of 11 cases have been confirmed to date. The authorities have been checking the branches that they are working on, and based on this investigation, we also have advised all of the visitors who have symptoms after visiting these Lotteria branches to get tested as soon as possible by visiting their respective screening clinics. And as for the Gunja branch, we ask for those visitors who have visited on the 6th and 9th to 11th of August, and they also include Myeonmok Central Branch, Seoul Station Central Branch, Chonggak Station, and Sungmyang University Branch and Kongguk University as well. And we will be also updating you with the press release and the SMS messages. And we also have it at the Gwangjin-gu district, food restaurants that these people have visited. And we also advise the people who with other visitors, if you have symptoms after visiting these restaurants, you need to get tested as soon as possible as well. And next, going to the Seongbuk-gu district, in relation to a Love Church, there we also have a first index case being confirmed earlier in August, and we have been going through investigation, and a total of 4 more people have been confirmed. In total, we have 5 cases to date, and investigation further is underway. In relation to an office space in Gangnam-gu district, after the first index case on the 6th of August, we have carried out investigations, and we have found relations with a family in the Gyeonggi-do city, Gyeonggi-do province, Gwangju city, and we have added them in under this category. And in total, we have 9 people for this cluster. And moving on to the Gyeonggi-do province in Yongin city, in relation to the Uri Taelu Church, we have also 1 additional case confirmed earlier, and we have 9 additional cases, and a total of 12 accumulated cases have been confirmed to date. And in Yongin city at the Jukjeon High School and also Daeji High School, we also have students and family members being confirmed. 3 have been confirmed additionally, and a total of 8 people have been confirmed to date. And next, moving on to the Busan metropolitan city, in the Haeundae-gu district, as for the mechanic high school, we have 1 case being confirmed earlier in August, and we have 2 additional cases, and the total now stands at a total of 3. And as for the local authorities' trends, as for the Seoul city, we have confirmed that on the 10th and 12th of August, the city has issued orders to refrain from having large-scale demonstrations. And on the 13th of August, it has decided to issue a ban on the large-scale gatherings on the August 15th. And if you carry out these planned demonstrations demonstrations, the Seoul City will be carrying out further investigation, and it will also ask for compensation if there are confirmed cases in relation to these demonstrations. And the local authorities and the quarantine authorities also note the fact that the administrative orders need to be complied with at all times, and we ask all of the members of the public to comply with our quarantine measures going forward. And we had a total of 9 new imported cases, and as for the countries, 2 were from the US, and 2 from the Philippines, and 2 from Iraq. And as for the R&D aspect, we have administered a total of 119 patients with remdesivir across the country. And as for the national development of vaccines against the virus, we have been considering the clinical trials, the first of the clinical trials, and this has been approved for the mid-June as well. And we are also conducting the further animal testings for the toxins, and we believe that 3 of the vaccine candidates will be commencing the clinical trials by the end of this year. And next, in relation to the life quarantine measures, the Ministry of Safety is also carrying out the website and the application of safety e-report, and we also noted that there were some summer retreats by the educational facilities, and they had mass gatherings, and they ate snacks together, and they did not wear face masks. And also many people who are working at the multi-use facilities like restaurants and marts, they did not wear face masks in a proper manner, and there were many cases of not compliance to the mandatory wearing of the face mask. So we once again highlight the importance of wearing face masks, and this is the most effective preventive measure against the virus at all times. At indoor spaces where it is difficult to keep 2 meters of distance, you need to wear face masks. And if you are even outdoors, if you cannot keep 2 meters distance, you need to wear your face masks. You need to cover your nose and mouth properly, and you shall not touch the surfaces of the masks. And you need to also wash your hands before and after wearing and taking off these masks. And in relation to the increasing of the cluster infections, we have seen 13.4% of the cluster infections are and were silent spreaders. And we ask all of those who have some symptoms to refrain from going outdoors and get tested as soon as possible. And abiding by these quarantine protocols compared to last year, up until the July of this year, the number of the rates of infectious diseases as well as the waterborne diseases have decreased slightly, and they were thanks to the compliance of the quarantine and hygiene measures. And compared to the year before, we have seen a downward trend of these infectious respiratory diseases as well as waterborne diseases. And these were all possible thanks to the members of the public being participative of the quarantine measures, and we would like to appreciate all of the members of the public. And today we have a heat wave advisory issued across the many regions across the country, and there are many people who are exerting their full efforts to engage in recovery work at the damaged places after the flooding. And please note that under these advisories, you need to also refrain from going outdoors at peak heat hours. And also, the same also goes for those who are working at recovery aspects. And before going to the recovery works, you need to consume a lot of moisture and water. And if you have symptoms or if you have if you feel dizzy, you need to get some rest under shades and cool places, and you need to also consume a lot of water. And ahead of the upcoming holidays, we are concerned of a possible outbreak across the country. We ask you to refrain from having small group meetings and comply with quarantine measures going forward. During these week of holiday, we also advise you to refrain from going to multi-use facilities facilities, entertainment facilities like PC rooms, and bars and clubs as well. And during this holiday, if you decide to travel, you need to wear face masks at all times if you are at indoor places. Minimize your stay hours at rest areas and other indoor places, and also keep a 2-meter distance with others. On the other hand, if you have symptoms like fever and respiratory symptoms, you shall not go on your vacation, and please refrain from going to the 3C places, which are crowded, closed, and close contact environment, and refrain from having close physical contact. And these were the updates on the press release, and here are some messages to the public as well. As of mid-August, we are seeing the cluster infections across the country, and we also have grave concerns against these outbreaks. And in order to contain the virus successfully, we believe that this is a time when we need to cooperate with the local government as well as the public as well. We believe that this is a state of a crisis. During the summer vacation and during the summer holiday season, the continued trend of an upward trend in the confirmed cases is also posing great concerns. And this is especially so for the case of Seoul Metropolitan City. And we have seen cluster infections in the Itaewon cluster, as well as the Busan logistics centers, and also door-to-door facility called Richway, and also there were other religious centers which posed great threats. However, this is an even more at a moment of crisis, because we believe that the latest trends have also spread through silent spreaders and those with no symptoms or slight symptoms. They have continued, and they have sparked, especially through multi-use facilities which are close contact, including religious centers as well as markets and schools. They are being spurring out across the metropolitan area in the Seoul city as well as the surrounding Gyeonggi-do province. And if this also coincides with the week of holiday as well as the upcoming weekend, especially and with the scheduled mass gathering and demonstration for the August 15th, we believe that this could also pose bigger threats. If these continues, we have no other choice but to have more restrictions on your daily lives. First of all, during the weekend as well as for the temporary public holidays, we ask you to refrain from having gatherings, whether they be small or big, and please refrain from these small gatherings, and please enjoy your family time at home. And if you need to go outside, please enjoy relaxed moments at less crowded spaces. We have to say that all places have the infection risks, and we believe that all of these meetings with people aside from your family members, whether they be religious group meetings and meetings of other kinds, are prone to the infections, and you need to always wear your face mask. And as for the Seoul and the Gyeonggi-do province in the metropolitan area, the rates of the risks of infection is very high, and during the weekend, if we fail to contain the virus, and if this transmission continues in and outside of the metropolitan area, we would like to note that all of the daily routines that we have enjoyed so far will be lost in the near future. And when you need to have meetings with your friends and your acquaintances, and we also advise you to refrain and cancel all of these gatherings as well as summer retreats. And if you have any symptoms, you need to get tested as soon as possible, and please take part in our joint efforts going forward. The quarantine authorities will also note that this is a sign of crisis, and we are seeing signals and signs of a crisis, and we will also exert our full efforts to this end. Thank you very much.
기자님들 질문에 답변 드리는 시간 갖겠습니다. 각 조사가 진행
Right, that was Kwon Jung-up, the head of the vice head, that is, of KCDC with Thursday's afternoon briefing. So do give us a summary.
Sure, a lot of updates on several cluster infections in Seoul, Gyeonggi-do Province and Busan related to churches, schools, offices, and the recent infection related to a fast food franchise business in the capital, Seoul. Over 50 people have been tested in that case, and now 11 people have been confirmed with the virus. Now, Kwon mentioned that ahead of the extended weekend, that is, people should refrain from gatherings, whether small or big, and that's also why the government has issued an administrative order on rallies to cancel those rallies during the upcoming weekend.
I see. All right. So thank you for that. We'll see you again tomorrow.
See you tomorrow.
August 14th, that is tomorrow, marks a special day to commemorate the dedication of delivery workers whose schedules have been especially hectic amid the pandemic and resulting preference for non-face-to-face interactions. Up next, we take a closer look at their working environment and at the efforts to enhance it.
Jo Ki-hyung is a delivery man who has been working in the industry for the last 6 years. Like any other day, he's hard at work, just like his fellow colleagues, to deliver packages quickly to the right place, no matter where he needs to go. Since the COVID-19 outbreak, delivery workers like Joel are now busier than ever before.
물량이 늘다 보니까 늘은 만큼 그 분류 작업도 늦게 끝나니까 그게 좀 힘들죠, 기사 입장에서.
Panic buying broke out across the globe in the early days of the pandemic, as desperate people raided store shelves for face masks, toilet paper, and other essential goods. But that was not the case in Korea, as the country's advanced delivery services ensured that people were never short on basic necessities. Korea's major delivery service companies reported a 10 to 20% growth in shipping volume during the first quarter of this year. Korea's delivery service industry has witnessed exponential growth over the past 2 decades.
우리나라 택배 산업이 발전된 것은 기본적으로 온라인 쇼핑의 장점을 살렸기 때문에 가능한데 향후에도 이 코비드가 계속 지속이 되는 한 온라인 쇼핑의 규모가 상승될 것이다라는 것은 자명한 사실이고.
But this isn't exactly welcome news for delivery workers, who are now working longer hours to meet surging demand. This has led to fatal consequences, namely the death of several delivery workers due to exhaustion.
코로나 때문에 물량이 너무 많아서 아침 일찍 출근하고 5시 반에 출근해서 8시, 9시에 들어오고 그래도 항상 웃었던 애들 아빠 모습이 생각납니다.
Delivery workers operate under contract and therefore do not have paid vacation days, like regular workers have as part of Korea's labor laws. Even taking sick leave is no easy matter and often frowned upon by their employers.
쉬고 싶어도 힘들어서 좀 쉬어야겠다라고 하게 되면 그날 수입이 없는 거죠. 그래서 거기서 끝나는 게 아니라 그러면 그 쉬는 동안에 그 물건을 누가 배송하느냐에 대한 문제가 있어가지고 장시간 노동을 개선하자는 취지에서 이제 그 캠페인을 했었던 거죠. 하루만이라도 쉴 수 있게 해달라 이제.
But delivery workers may get some relief after all, and a well-deserved break. August 14th has been designated as Delivery-Free Day, where no packages will be delivered. Meanwhile, the government plans to draft a new law to improve the working conditions of contract laborers, including delivery workers.
택배가 이제 시작된 지 이제 한 28년 됐는데 전례 없는 일이거든요. 그래서 이제 택배에서도 뭔가 좋아질 수 있는 개선될 수 있는 그 시점 단초가 마련된 거 아니냐 저희들이 이렇게 평가하고 있고 저희도 이제 인간답게 살 수 있는 길이 이제 열려가고 있다 이렇게 생각하고 있습니다.
Delivery workers have played a key role in our social distancing routines, and they now get a well-deserved day off to rest and recharge as a reward for their efforts.
In in Saudi Arabia, authorities there concluded a dramatically downsized annual pilgrimage to the holy city of Mecca earlier this month, with reportedly no cases of COVID-19. For more on the situation there, I have Hannah Kim, a resident in Riyadh, live on the line. Hello, Hannah.
Hello, Sunny. Marhaba.
Marhaba. Hannah, perhaps you could start by telling us a bit about the COVID-19 situation in Saudi Arabia.
Yes, on August 11th, the Saudi Ministry of Health reported that 1,521 new confirmed cases were found and 34 people lost their lives due to COVID-19. But the good news is 1,640 people recovered from the disease. We do face the same threat of COVID-19 here in Saudi Arabia, just like many other countries around the world.
Hannah, compared to its total number of infections, which is almost 300,000 cases, its mortality rate, that is quite low. How are authorities explaining this rather fortunate phenomenon?
Sure. Saudi Health Minister Tawfiq Al-Rabi'a said in a statement that the death rate of COVID-19, the kingdom, is 10 times lower than the global rate. The minister attributed the low death rate to the unified treatment protocol and random screening to discover and treat the case at the early stages. I think this is the true, but I also believe the fast recovery of COVID-19 patient is another factor to this low death rate. Although birth rate is showing sign of a decline in Saudi Arabia, it still has a relatively decent rate compared to other countries around the world. Saudi recorded a birth rate of 18.51 births per 1,000 people in 2019, according to CIA World Factbook. And this indicates that the country's society is quite young, and we all know that younger people has a higher chance to recover once they get infected.
Hannah, now, as I mentioned earlier, the Hajj came to an end earlier this month with the fewest number of Muslim pilgrims. Usually there are some 2.5 million people, but this year just about 1,000 took part. Please tell us more about that event.
Sure, Sunny. The Saudi government has also considering shutting down the Mecca since March and canceling the regular pilgrimage this year, but eventually decided to greatly reduce the number of pilgrims considering religious importance. Saudi Arabia Holy Land Pilgrimage Department announced that it received the applicants from 160 nationalities and classified according to health standards and selected them accordingly. 70% of the approved pilgrims were foreigners and 30% were Saudi nationals. All pilgrims must be tested negative before come to the Mecca, and after completing their pilgrimage, they are required to be self-isolated for 2 weeks. And pilgrims toured around the Kaaba temple within the line that is pre-marked from the Saudi government. And police deployed everywhere in the area continuously check if the social distancing measures are being kept.
I see. Hannah, what are some of the other prevention measures that have been adopted by Saudi authorities to curb the spread of the virus?
Yes, the Saudi government has imposed a strong measure in late March. People are only allowed to use nearby facilities such as a mart and pharmacy, gas station from 6 a.m. to 3 p.m. If someone violates this curfew, once they will find about 3 million Korean won and twice the fine that it can be doubled. And for the third time, they are put in the jail for less than 20 days. And many mosques are closed or meetings were regulated, and service jobs such as a fitness center and hair salon were suspended. Only recently, around June, things slowly returned to normal, and the fitness center where I work also opened its door again. The center is making effort in many ways, including temperature check and using personal towel and keeping distance, wearing mask when I'm coaching, and disinfecting item each after class.
That is good to know. Hannah, one final question. How is the Korean community there coping amid the pandemic?
Yes. The number of Korean residents in Saudi Arabia is about 2,000. They are making their living as a nurse, Korean school teacher, sport coach, and construction manager, etc. And some of them quit their job after outbreak of COVID-19, while others return to their home country. There are many other residents staying here and waiting their jobs go back to normal, just like before the spread. They did not losing job, but they are having hard time because they cannot make money, and they are hesitant to go back to Korea because they are risk not being able to come back to Saudi Arabia again. And airway in and out is currently blocked, so Korean residents are here anxiously waiting for the day when things go back to as they were before.
Right, we're hoping for that day as well. All right, Hannah, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you so much, Sunny.
증상이 발생하기 이전에도 전파가 가능하다는 것이 분명하게 확인됨으로써
There have been quite a few developments with regard to COVID-19 in recent days. Here in Korea, chain infections in the metropolitan area have authorities on high alert, while in Russia, researchers claim to have found a vaccine. For more on these events, I have Director Kim Moon-gyu of the ODA Center at the Yonsei Institute for Global Health. Welcome back, Director Kim.
Thank you.
And I also have Dr. Alice Hyun-kyung-tan from Miss Medi Women's Hospital. Good to have you back, Dr. Tan.
Thanks for having me.
Now, Director Kim, cluster infections here in Korea, especially in the metropolitan area, continue to be a source of concern. Especially today, local infections reached 47 cases, which is the highest in 41 days. How do you assess our current situation, and do you believe our measures need to be toughened up?
Well, every time infection happens, there are two factors we have to be concerned. First one is the human factor, and second one is the virus factor. And for human factor, we have to consider the immunity of the person and his behavior, where he visited. And the virus, we are talking about the coronavirus, and we have to understand more about the characteristics of it. About 50% of the cases coming from overseas, and significant portion of patients in domestic cases, we don't know how they got infected. So I think it's time we have to consider more about the small meetings, such as the church meetings, cafe, restaurants, and gyms. And I hope that Korea CDC might give a more precise indications which one is allowed and which one should be prevented, such as how big is the room and how many persons can go in there and what kind of measures they have to keep during that meeting, and where it's have a window or is in the basement. So it should be applied to all the meetings, not only for the churches and everything. So I just want to talk a little bit about the European guidelines. I think they allow the restaurants to be open, but they only allow the tables outdoors. If you want to stay indoor tables, it is now allowed. You can just take it at home, and you have to close the restaurant after sunset. So that's just an example, and I hope that Korea CDC might give us more precise indication about that.
I see.
Yep.
Dr. Tan, the infections that we talked about right now, the local infections, they started at a church in Goyang City in Gyeonggi Province. They've spread to a traditional open market here in Seoul, the Namdaemun Market. Some 300,000 people are known to visit this market on a daily basis. What are your concerns given this reality, and what words of caution would you care to share with the public?
Well, unfortunately, this is a recurring pattern that's been happening. So an infected person goes to church, spreads it among church members, and then from there it's spread to family members, and from there to other places of work. In this case, it included a preschool, and now the Namdaemun market. There are three particularly concerning aspects of this case. First of all, the timing. So it seems that the spread from the church member to the marketplace occurred July 31st, but the index case wasn't discovered until August 5th. Also, the Namdaemun was not identified as a branch of this cluster until a few days ago. So that's about 10 days during which the virus could have spread before targeted testing has been started. And that's, of course, very concerning because we are racing against time always to get these types of clusters under control. The next aspect is that tracing and tracking has been difficult because credit card information, CCTV data, they're not as readily available in this setting, in this particular market. And then, of course, the scale. Whenever we hear about an outdoor and open traditional market, immediately we think about Wuhan and Beijing and the potentially hundreds, maybe thousands of people who could have been exposed. And so this is a very, I think, alarming situation, but it brings to point the importance of personal hygiene. Everyone really needs to make sure that they are washing their hands frequently and wearing a mask in all situations, because even if a person had touched a contaminated object, if they washed their hands frequently that day, the infection could have been stopped. Also, if you had come in close contact with an infected person and both of you were wearing masks, the risk of infection is much lower. And so I think really the important message is that the virus is still out there and we need to be careful.
We need to take prevention measures very seriously then. Director Kim, earlier this week, authorities revealed that tests on imported cases showed 3 mutations, new mutations to the spike protein of the coronavirus, which I hear is responsible for the ability of the virus to invade human cells. Please tell us more about these findings, about these mutations, and how concerned should we be about them?
Well, it's because it is coronavirus, RNA virus, and it's created to be mutating. So the imported cases are new, and already we have thousands of mutations, but it's never been reported before. And I'm sure that we're going to have more mutation in the future. And actually, it reminds me about the Spanish flu, which was in 1918, and United States have 3 outbreaks, and the second and third one was imported through the port of New York and San Francisco. That means we have to be very tight on controlling airport and seaports also. And there are 3 main issues when we discuss about mutation. Is it more infectious? Is it more lethal? And is it going to change the plan to make a vaccine? So until now, only 1 case of mutation behaves very strong, which causes more infection, which is the D614G. And whenever there are 2 versions of virus spreading in the community, always the last one takes the first one. I mean, the more you have a pandemic, you have a more chance to have a more infectious one. So we have to check every mutation and take the research about the characteristics. But fortunately, I would say that the coronavirus is changing slower than the Spanish flu, H1N1. So that's something we still have some time to react.
I see. Dr. Tan, I'd like to take your attention outside of Korea for now. Russia earlier this week announced or registered the world's first vaccine, with President Vladimir Putin claiming that one of his 2 adult daughters had been inoculated. What are your thoughts about Russia's claim of a vaccine?
It was quite remarkable if you consider that it normally takes years for a vaccine to go through all of the phases to be found safe and effective. Of course, for COVID-19, the process is being condensed, but even still, it's quite remarkable. Now, when you look at what they've done, basically this vaccine was tested in 38 healthy volunteers. The trial started June 17th, and it was approved just a few days ago, so that's less than 2 months. I don't think any scientists in the field of virology and vaccinology could consider this enough testing to guarantee the safety and efficacy of this vaccine. And so to have approved it, I think is risky and could put people, in harm's way, potentially serious side effects. It may work, it may not work, we don't know because we do not have phase 3 trial data. And another important consideration is that we have seen what happens when fake news, when poor communication, mixed messaging, when that gets out into the public, you have distrust. And when you have public distrust, you cannot get the type of unity that is needed to fight the pandemic. And so in a lot of different ways, this is, I think, not a good move for the global picture of COVID-19. It's unfortunate that it had to happen this way.
Right, hence the skepticism from the international community regarding this claim of a vaccine. Director Kim, given the circumstances surrounding COVID-19, including the mutations of the virus itself, what direction should treatment efforts flow, very briefly speaking?
Yeah. First of all, we have to keep the same efforts we used to have, the social distancing, mask and hygiene and everything. And we must keep the supply good. I mean, we should not have a problem with logistics. All the hospitals should have the supplies, and even companies and every marketplace, they should be prepared for hand hygiene. And we should keep on researching about the virus. We still do not know everything about it. We should know more about it and respond to the new mutations. And we have to consider about the vaccine. And I would say two things about the vaccine, which one is the first one, vaccine efficacy and vaccine effectiveness. Vaccine efficacy is something we can gain from randomized controlled trial, which takes some time. But the more important thing is vaccine effectiveness, which considers everything, the final result of the vaccine, whether it's effective or not. If you look at the flu vaccine, I mean, for influenza virus, the effectiveness is only 60 to 80%, which is very low considering the decades of research and clinical experiences. So it takes time to have the confining results about the new vaccine. So,
as Dr. Dan had said, time is essential.
We should be patient about that.
I see. All right, Director Kim, thank you very much for your thoughts. Owing to a lack of time, we'll have to end it there. Dr. Dan, as always, thank you for being with us.
Thank you.
Thank you.
Right, well, on that note, we end Thursday's coverage of COVID-19. Tomorrow, we bring you scenes of the new normal in the work environment. So do join us then. In the meantime, do take care wherever you are. Thank you for watching.